Yes, how many of you have ever been told to go and get an angiogram done? And how many of you have had relatives who have been told to do this and were worried to get it done? This is Dr. Lenny DeCosta, a geriatric physician, functional medicine expert, and the author of the upcoming book, Is Your Doctor Keeping You Sick? Yes, my dear friends, over the last 17 years, I have been treating heart patients, ischemic heart disease patients, non-surgically. And more than 90% of these patients have come to me because they either did not want to get an angioplasty done post their angiogram or did not want to get their bypass done. And many of them didn't understand if they had any choices other than just the surgical interventions. Yes, my dear friends, today I want to explain to you that you may have more choices than just the surgical interventions. And one of the choices that I use for most of my patients who have had ischemic heart disease is what we call chelation therapy, among others. Now, chelation therapy, how does it help a heart patient? And how do you actually benefit from taking this whole therapy over a period of 2-3 months that it lasts? And how does it actually help your status as far as ischemic heart disease goes? Well, let me tell you that there is enough and more literature that links ischemic heart disease to, number 1, pollution, number 2, heavy metal toxicity, and number 3, bad nutrition. So when you have such a huge linkage, the only thing that makes sense when you have a disease is to remove the causative item rather than just go and sort a symptom. Now, in this case of ischemic heart disease, what does actually happen? If this is your heart, your left hand, if you fist it, this is your heart. There are 3 major arteries that sit on the top of this. These, when they get blocked, you do not have enough blood supply for your heart muscle. Now, those blocks are known as plaques. The causes of them are many, but one of the major causes is what is called inflammation and oxidation. So inflammation within the artery has been known to be caused by a process called oxidation. And this oxidative stress or oxidation has resulted most of the times due to toxicities in our bodies. Now, the toxicities are heavy metals, the toxicities could be bad nutrition, the toxicities could be excess stress, due to which you have also oxidative stress. So mental stress, and you have oxidative stress. So it could be anything, but one of the major things that you have is heavy metals. So it makes sense that if you want to get rid of the inflammation and the oxidative processes that are within the arteries that actually cause that plaque, you need to get rid of the metals within your body, get rid of the toxicities within your body, and change the nutrition. So what is chelation therapy? Nothing but doing all this, getting rid of your toxicities, ensuring that you have good nutrition, and ensuring that your nutrition, if you do not get it through your food, is supplemented. And of course, we also add lifestyle changes to this. Now, what are the benefits of chelation? Well, you improve your blood supply to the heart muscle, so you do not get the symptoms anymore. So we've gone to the root cause of the problem rather than just going and sorting out the blockages that these 3 arteries have. Because what would you do in an angiogram, in an angioplasty or in a bypass? In an angioplasty, you would just put a stent and open up that block, whereas the biochemical process that is happening within the artery remains the same. Whereas if you're doing a bypass, you would just bypass that vessel and ensure blood supply comes distally to that means beyond that block, so that you get some blood supply to the heart muscle, but the basic biochemical reaction of inflammation and oxidation within that artery remains the same. So when this remains the same, the chances of the disease recurring are very high. When you go and take care of the root cause like we do in chelation, yes, you may have the chances of the recurrence being less. And therefore my patients ask us, is this a one-time treatment? No, it isn't. You can clear your house once. Does it remain clean permanently? No. You are still exposed to the environmental toxins. You are exposed to the heavy metals in the air. You're exposed to the heavy metals in the water, in your food. Your food still has its own issues and you don't get that nutrition the way you need it because you need your minerals and vitamins. And you still have bad water because the water also gets polluted off and on. So you're still in that same environment and you can't change this environment. So what you can do is detoxify regularly. Now, what is the benefit of chelation? Is it just benefiting your improvement in your heart disease? No, it also takes care of a lot of the other chronic diseases. It takes care of diabetes to some extent. It takes care of prevention of cancer in many cases where if you didn't detoxify, probably you would get cancer later on in life. But more importantly, it stops premature aging, and therefore, my dear friends, it just does not benefit your heart, it benefits the entire blood, circulatory system. It ensures that you live a healthy, happy, and a more cheerful life. So my dear friends, if you feel that you need an alternative to a surgical intervention for your heart, do get in touch with us, do send me a mail, and I will respond and we will give you solutions that possibly could help you. We are available in all our clinics, but it's just not me. You can find a practitioner who does chelation anywhere in this country and across the globe and probably get a consultation from him and get an opinion from him and see whether he can help you. If you like this video, please give me a thumbs up. Do visit my YouTube channel. I have got lots of videos that can help you in your healthy living. And yes, do write to me if you have a specific query, and I'll see you soon in my next video. Bye for now.